This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, the life-lifting news program for women. On today's show, we're talking about minimally invasive surgery. We're here broadcasting at the beautiful new Medical City Children's Hospital in Dallas, and I'm absolutely delighted to introduce our next guest. Dr. Anh-Hong Tran is a board-certified urologist with Dallas Urology Associates. She was born in Vietnam and grew up in Houston, Texas. After graduating from Harvard University, she spent time in Asia and then California before returning to Houston for medical school at Baylor College of Medicine. Dr. Tran completed her general surgery internship and urology residency at the University of Texas Southwestern Medical Center, Parkland Health and Hospital Systems. Dr. Tran, welcome to the show.
Thank you so much. I really appreciate the opportunity to be here.
We're delighted. Now, we're talking about minimally invasive surgery today, and we talked to Dr. Catherine Waldrop in the first segment. Dallas-based gynecologist. You specialize in urology. Why that interest or that area of medicine?
Well, ever since I was 5, for some reason I decided I want to be a general surgeon. I think for me, it's more of the mentality. I wanted to be able to do something and feel that I had tangible results I could see. And I didn't know what it was when I was 5, but as I grew older and when I went into college, I still had that in my mind. When I went to medical school, I got exposed to what general surgery entails, and I still loved it. I loved operating. I loved the procedures involved. But then I became exposed to urology, which is a subspecialty of general surgery. I think, like a lot of other doctors, part of the decision was influenced by the people I encountered.
Yep.
The urologists I encountered were just fantastic people who were very well balanced.
Great
to me,
mentors. Yeah.
Exactly. And the surgeries were also wonderful. There's a wide breadth of it, from cancer surgeries, big operations where you're removing bladder cancer and reconstructing a new type of bladder, to more delicate reconstructive surgeries for stricture disease and different things like that. So just a wide breadth of it, and the people in the field, that was what drew me.
And you have results that truly enhance people's lives, get them back to full functioning, which is fantastic.
Absolutely. It's not just, cancer surgeries, which are necessary, but also elective quality of life type of surgeries that improve people's lives.
Well, let's talk specifically about minimally invasive surgery, this laparoscopic surgery, and how it impacts your particular practice. We're going to focus on robotic assisted laparoscopic surgery for pelvic organ prolapse. That's one of the areas you want to talk about. Explain in layman's terms what pelvic organ prolapse is.
Well, pelvic organ prolapse, basically, we're talking about the pelvis. And as I brought a model here just to make it a little bit easier to understand. When you're talking about the pelvis, there are several organs there, and central to it is the vagina, which is illustrated here. In front of the vagina is the bladder, and then behind it is the rectum. There's a band of muscle and several connective ligaments that help to keep everything in place. It's sort of like if you're watching Cirque du Soleil and those women or men who are up in the air and they're connected to the wires that keep them in place. If the attachments start to, loosen, then they're certainly going to go lower down in the air.
That's a great analogy.
Yeah, the same thing is true with the pelvic organs. And so, certainly with age, with multiple childbirth, vaginal deliveries, with other pelvic organ surgeries like hysterectomies where the uterus is being removed, with just genetics alone, just depending on the quality of your tissue, you over time will notice some descent of the different organs. That's what prolapse refers to.
Okay.
So any of those organs can start to descend. For instance, the bladder, if the support to it starts to weaken, then the bladder can start to descend outside of the vaginal opening. And that could be separate from the top portion of the vagina, or if you still have a uterus in place, if you haven't had a hysterectomy, then the uterus can also come down. Same thing with the rectum. Any of those support structures, once they're gone, then you're going to have the anatomical position no longer exists and they start to come down. I think as women age, they seem to think that it's natural that they may feel something there, or that other things are coming up. And for instance, depending on which organ is starting to descend or prolapse, it manifests in different symptoms. For instance, if the bladder is going to start to come down, you may start to find that you have to urinate a little bit more frequently than usual, or when you have to go, it's a little bit more urgent, or they have more leakage of urine when you cough or laugh, different things like that. Or with rectal prolapse, that may be a little bit harder to have a bowel movement, that you may be constipated, or if the uterus is coming down, that it's uncomfortable to have intercourse, those type of symptoms. But I think a lot of women tend to think that it's a natural part of aging, that it's normal, rather than seeing it as a sign of something that there may be a solution for.
Exactly. Now we were talking, I'm noticing these instruments you brought for our viewers, and I'd love for you to demonstrate or show our audience.
Before I show you those, I did want to just give a little bit of a history of laparoscopic surgery and robot surgery.
Absolutely.
Yeah. Historically, all surgeries were done in an open fashion. You make a large incision, and then you address whatever organ has to be operated on. And recovery depended on the length of how big the incision was, the length of the surgery, different things like that. We always say exposure is key, and exposure sometimes can be very difficult, especially if you're operating in something like the pelvis, where depending on the size of the patient, it's almost like operating in a deep hole. So starting in the, as technology advanced, starting in the late 1980s, early 1990s.
So this is when this type of surgery or these...
Yeah.
Okay.
Then we started to have laparoscopic instruments that we could use, and it really depended on having cameras that were small enough with a great enough resolution so you could really see things.
Right.
And so that's when, as urologists, we really started to adopt this technique for such procedures as radical prostatectomies, where if a man has prostate cancer, we're removing the prostate, or for nephrectomies, where if you have a kidney tumor or some kind of pathology with the kidney, we're removing the kidney. So the instruments changed and the incisions changed. They didn't have to be these large incisions just to remove these small little organs.
Exactly.
They could be small incisions, maybe 1 centimeter in length. And then the next step after that was using a robot to assist with these laparoscopic surgeries.
Dr. Tran, can you hold that thought?
Absolutely.
We have to go to break, but when we come back, we'll continue our conversation with Dr. Tran. This is Siobhan Palmer with Platforms, the life-lifting news program for women.